I think within the African American community, mental health is very challenging because they don't want to talk about it. But also coming to find out that even in the Hispanic community, young people didn't want to talk about whether they had a mental illness or not.
What oftentimes occurs is in promotional campaigns or outreach efforts, this isn't a population that necessarily gets tons and tons of attention. The population may be included to a certain extent, but we really wanted to have a couple of campaigns that were very local level to try to specifically reach out to youth who oftentimes may not get reached out to at such a specific degree. So what we did is we teamed up with a group of youth from the Houston area. They were really our focus group / advisory group throughout the entire process. And so they were really, really instrumental in making sure that the product that was developed was going to speak directly to the specific age group, racial ethnic group, and specifically males.
The youth really felt valued in working with the focus groups. When it came to getting ideas from the focus group, and two of our youth sat and talked on the phone with the marketing company, they really felt valued, that everyone listened to them. They really took their feedback. Whereas oftentimes our youth may sit in meetings where adults don't value them.
Let's talk about mental health. It's certainly an issue that impacts all communities, that impacts every person to some degree, shape, or form. And so we really wanted to encourage youth to just feel free and feel liberated and feel empowered to start talking about it. Start talking about it amongst each other, start talking about it with family and with teachers and other supportive adults, and really just kind of get it out there. In the Rio Grande Valley, this is an area that has a high Hispanic population. It's fairly close to the U.S.-Mexico border, and it's an area that it doesn't get as many services, doesn't get as much attention as maybe some other areas in Texas. So what we did is we worked with the local juvenile justice department and other service providers in the area to create some face-to-face campaigns. In the first one, we focused on youth who are involved with the juvenile justice system and really getting out there this message of again, it's okay to talk about mental health, and also really tying that into resiliency and promoting hope and promoting encouragement. And so we had a young man, his name is Jason Wang, come and speak, and we just kind of paraded him around to a whole bunch of different sites in the valley to talk with hundreds of youth who are involved with the juvenile justice system. Jason Wang is an individual who he himself was incarcerated in the Evans Detention Center, which is one of the locations where he talked to a number of youth. And he has just a really encouraging story. He's very open about his own struggle with mental health concerns, and he really gave a message about that resiliency piece, and that's really what we wanted to hit home. A lot of the youth that he was speaking to come from broken homes. A lot of the youth that he was speaking to have some very, very specific concerns that when they were going to get out of detention or get off probation or parole or whatever the specific case might be, they still had to live life. Jason was able to be someone to say, I get it, I've been there, I've had these struggles, this is what I've been able to do, And you can too. Maybe you're not necessarily going to follow my exact journey, but you can do it. You can be strong. You can have healthy people in your life. You can take advantage of these strong supports and make progress in your life as well. So that was a really, really powerful message. We want to see that all groups are able to engage with the system of care and be a part of that system of care community. That all groups are being at the table, that all groups are represented, and that all groups are engaging in services in a way that promotes those positive outcomes that we want to see for everybody.